So my name is Rex Jarrett. I am the Director of Professional Programs here at UMBC. I work out of our Sherman Hall, overseeing our DPS or MPS programs designed for folks who are looking to learn specialized knowledge about becoming a working professional or entering certain industries. The Pause and Pivot webinar series is something that was born out of UMBC in an effort to do what we can to support our fellow Marylanders and DMV residents who have been impacted by recent changes at the federal or executive level of government. So today's series will be on biotechnology and led by UMBC's own esteemed professor, Mark Schenerman. So I will hand it off to Mark, and you all hope you're excited for everything he's got to share with you. We do ask for folks to complete surveys on these sessions. It lets us know, are we offering sessions that are useful and helping folks navigate these transitions in their lives and in these careers, and letting us know if a particular session what worked well, what we may need to do differently. So you can scan the URL now, but please watch the presentation first so you can give feedback on it, but feel free to have it queued up for whenever you are ready to provide your feedback, and I will leave it to Professor Schenerman.
Thank you, Rex. Today's session is going to be particularly directed toward either current HHS employees or former HHS employees, and it's going to be more of a focus on those with scientific, technical, or regulatory backgrounds. So I realize that's a pretty diverse group. So the slides you're going to see here today are pretty fundamental. Don't really go into a lot of technical details into pursuing various aspects of career pathways. But I do give some general examples of career pathways and how you might consider entering them. So a little bit about my background. As Rex said, I'm currently a professor of biotechnology at UMBC. I'm also a graduate program director for the Master's in Biotechnology program, which is held on the Shady Grove campus in Rockville, right close to HHS. But I've had actually over 30 years experience working in the biopharmaceutical industry. 23 of those years was at MedImmune AstraZeneca, before that Bristol Myers Squibb. So quite a lot of experience working in the industry, and still maintain a pretty extensive network of people that are currently working in the industry. So first off, what we want to do is take a look at why would you even consider a career in the biopharmaceutical industry? Well, it is, and you could look at it as an opportunity to apply your previous knowledge in the public sector. The industry has very competitive salaries and benefits. There's oftentimes a strong opportunity for growth, and lots of innovation occurs in the industry. And there's also an opportunity to have a broad impact on global health. Could be similar to the impact you have now, or it could be even greater. Well, the first thing to do is to sort of understand what the landscape looks like in the industry, and understanding the difference between large pharmaceutical companies and biotech companies. Also taking a look at what are the different aspects of these industries. Obviously, there's R&D, manufacturing. There's a regulatory component in industry. Those are professionals that are dedicated to regulatory affairs issues. There is a preclinical aspect to what goes on in industry. It's not just toxicology. It could be any types of preclinical studies, including pharmacology. There's clinical aspects, and there's quality assurance and quality control. Then the industry is made up of, obviously, big pharma, which are multinational firms with many thousands of employees. There can be mid-sized companies, many of which are located in Maryland, which we'll talk about later on. And there are lots and lots of startup companies. And again, many of them are located in Maryland. So when looking at the different types of pharmaceutical companies, you want to consider what the differences between them may be and how that might fit you better with regard to your skill sets. Big pharmas do tend to have a lot of infrastructure already built. They provide a lot of training for you. So if you're early in your career, a lot of the training in industry could be especially helpful to you. And then big pharmas tend to have a lot of resources with regard to instrumentation, dollars to support studies moving forward. Smaller biotech startups generally tend to be more entrepreneurial environments. So there's a lot more agility, and the expectations for employees are that they have much broader responsibilities. You really have to wear a lot of hats when you work in a biotech startup. So some find that to be a challenge that is worth taking. Of course, the risks are greater in a biotech startup because you have to worry about how long they have funding for. Then also, you do want to consider CROs, which are contract research organizations, or CMOs, contract manufacturing organizations, both of which there are quite a few of in Maryland. They do provide a client-facing experience. So these are services for the pharmaceutical industry. And again, your HHS experience may be very useful in CROs and CMOs. So you have to think about the culture in each of these types of organizations and which one is the best fit for you. So how might you translate your government experience into something which could end up being a career in the industry? Well, first, take a look at your skills and see which ones are most transferable to industry. Regulatory knowledge is always highly valued in the industry. That's why there are dedicated professionals that work in the industry on regulatory affairs. But even positions in research and development or manufacturing require some regulatory knowledge. Knowledge of health policy is often extremely valuable in the industry. Again, there are whole groups that are just dedicated to health policy. So your experience at HHS could be very applicable. And data, of course, is the heart and soul of everything that the industry does. So being able to analyze and interpret data is extremely important. Also, having a federal perspective on the industry could be valuable in many, many different ways. Knowing how the federal government looks at the regulation of the industry, how the federal government contracts with the industry, those could all be valuable perspectives in your future industry role. And then looking specifically at your experience at HHS, where are you currently, or where were you recently? Were you at the FDA, the NIH, NCI, CMS? Probably where you were working will determine what your current skill sets are and what you might be able to offer to the industry in the future. So what are some typical roles that might be well suited for HHS professionals? I already mentioned regulatory affairs. Most pharmaceutical companies have a group that's dedicated just to regulatory affairs. They also have groups that are dedicated to clinical operations, medical affairs, quality and compliance, and health economics and outcomes research. So this could be particularly relevant to those in CMS. So again, consider where you have been recently and which of these might better match your previous skill sets. So the first step in taking a look at whether or not you could successfully transition into industry is to do a self-assessment. You first want to take a look at your current resume or CV and update that, and also take a look at your LinkedIn page. Any future employer is going to look first at both of these tools. It's really, depending on where you are in your career, most of the time I would recommend, especially to students in my program, you really want to have a 1 to 2 page max resume that you will post for any position. If you post anything much longer than that, you have to think the hiring manager is going to spend maybe 30 seconds to a minute reviewing your resume. So if you submit something that's 10 to 15 pages with all your publications and presentations, it's probably not going to get read. However, your LinkedIn profile does get often a lot more scrutiny than your resume. So it is worth spending more time on your LinkedIn profile. You can put a lot more detail in there, and then people can look at that at their leisure. So I would always recommend to students, and I would recommend to you as well, that you take a careful look at your LinkedIn profile. You can model this to other people. I can share my LinkedIn profile with anyone who wants to in this seminar. Just take a look at mine, see what kind of detail I put in mine. And you could look at other people that are currently in industry and model your LinkedIn profile to theirs. You want to take a look at what your current interests are. Are you more interested in regulatory affairs, quality, or have you thought about doing private consulting? And we can talk later about private consulting. There are many different types of private consulting. There's your own individual business that you could start by yourself, or you could join a consulting firm that might have hundreds of consultants in it. So both of those are quite different working experiences and cultures. So it's something you want to think about as well. And one other thing to think about is what are the trends that are expected in the future in the industry? So there's probably going to be more of a movement toward gene therapy. The use of AI in drug development is rapidly increasing. So if you have skills in either of these areas, these are major growth areas in the industry, it's more likely that there are going to be openings. So you need to think about what gaps you might have in your skill set that you would want to address for the future. You need to sort of gain more of a commercial mindset versus a public health mindset. If you've been working in government, you're probably thinking from the perspective of public health. You work in industry, public health is always a concern as well, but industries are in business to make money and be successful. So you have to sort of gain that additional perspective. And then having a business acumen, understanding how budgets operate, and KPIs and timelines is also critical in business. Understanding that the pace is different, the pace is often quite fast. Projects can come and go very quickly. If, for example, you're a postdoc at the NIH, you may be used to working on a single project for years. Your projects could change many times within 1 year in a pharmaceutical company. And you have to be flexible. You have to be able to quickly change your research tactics in order to meet the needs of the business. There are also a lot of cultural differences in private industry versus the government. Some of those cultural differences have to do with having the business mindset. And then there are many industry-specific tools and systems that you'll need to learn and adopt to. Some of them are going to be dependent on your job. You may have to learn something like Salesforce or Viva or other types of industry-wide systems. So when thinking about your resume and your LinkedIn update, again, recommending that your resume be condensed to 1 to 2 pages. Again, busy hiring managers, that's all they're going to have time to look at. You want to have a concise statement about positions that you have previously held or currently hold, and whatever your key accomplishments were in those positions. And even if, because you're limited with space and 1 to 2 pages, even if you're listing just the last 3 or 4 of your positions and major accomplishments, that may be enough. You definitely need to highlight the skills that are in demand in the biotech industry. And some of those are listed here: regulatory, bioinformatics, AI, product development, and combination products. These are all high demand areas. Again, your LinkedIn page can be a lot more detailed, and we're going to have an example, a link to an example later on. So when you build a resume that's meant for working in the industry, you want it to be action and results oriented with regard to language. Make sure you don't use a lot of federal terminology that may not be broadly understood across the industry. So try to avoid using a lot of abbreviations, spell things out because it may not be understood by the person who's reading it. And then you have to tailor your resume to the job posting. You can't just make one resume and send it out to 50 different applications. You need to customize it for that particular posting. And Rex is probably going to tell you also that UMBC can provide some assistance for you with tailoring your resume. If you go to careers.umbc.edu, those resources are being offered to you. And then a key focus in your resume needs to be, this is what managers are looking for, is cross-functional collaboration and stakeholder impact. So make sure those themes are covered. With regard to your LinkedIn page, make sure you build a strong, detailed, industry-facing profile. Make sure you use keywords that are in demand that we've already talked about, like regulatory strategy, clinical development, depending on your skill set. You can follow companies that you're interested in. If you're interested in big companies, then you could follow companies like AstraZeneca, GlaxoSmithKline. If you're interested in medium-sized companies, follow them. Startup companies may not have LinkedIn groups. And within LinkedIn, you can signal openness to working. So when thinking about career pathways, first step is to find out more information about the career pathways. Then think about, do your current skills match those career pathways? If not, you may need to do some upskilling to be ready. And what if you're not sure if your skills are a match for a particular pathway? Well, that's partly why we're having the discussion here today. So here are some example pathways in biopharmaceutical development. Why did I pick biopharmaceutical development? Because that's the area where I used to work in, so I have a lot more expertise here. In biopharmaceutical development, we're almost always looking for people with cell culture, scientific experience, people who are able, I'll see some more details in subsequent slides, purification scientists, analytical development scientists, and formulation development scientists. A typical cell culture scientist, this is the type of job they might be doing. Developing a primary cell line or cell bank, optimizing the cell lines so it can maximize production, ensuring that it is free of adventitious agents and is genetically stable so it can be used for long-term manufacturing. You would be developing the process to manufacture sufficient quantities of the product to support ongoing clinical trials. You optimize bioreactor design, media, and self-feeding to minimize cost and maximize production. And you want to be able to deliver product to support pre-clinical studies like GLP tox and then ultimately clinical trials. The background needed to have a position of scientist or senior scientist level position is BS through PhD with a focus in cell biology, biochemistry, or chemical engineering. So obviously the PhD is going to be more the senior scientist and the BS is going to be more the scientist level. For purification, obviously you're going to be developing a high yielding purification process that is intended to create GLP tox material or GMP material for clinical trials. It should be cleared of impurities and microbial contaminants. It should have a high yield and purity, and it should have suitable in-process hold steps, and it should be scalable to support clinical trials. And typically, again, from scientist to senior scientist level, be people with background in biochemistry or chemical engineering. For analytical development, you can see there's really a wide range of skills that are needed in analytical development. This has to do with developing test methods for assessing identity, purity, potency, and safety, characterization methods for the product, qualifying test methods, developing bioactivity assays, which are surrogates to potency, employing those test methods for determining the shelf life of the product, evaluating comparability after process changes, and developing suitable reference standard material. People that are successful in analytical development have a broad range of backgrounds: chemistry, biology, biochemistry, cell biology, and pharmacology. And pharmacology people are especially well suited for working in bioactivity potency assay development. For formulation development, also a wide range of skills needed to support pre-formulation studies and understand degradation mechanisms, to develop a stable formulation to support preclinical toxicology and early clinical trials, to recommend the formulation which would be used moving forward to support ongoing clinical trials, and to also do compatibility studies with infusion sets. And then to recommend the drug product which is used for the final container. It could be a vial, it could be a pre-filled syringe, or something else. Formulation development folks have also a broad background in chemistry, biochemistry, pharmacology, or chemical engineering. The next step is to start to do some networking. So you can reconnect with former colleagues at HHS who have already joined the industry, talk with them about what steps you might take to move forward and transitioning into the industry. Joining a professional association can be extremely helpful, and I've listed a few here. PASS is a really good one for the biotech industry. RAPS, if you're more interested in regulatory affairs, DIA and ISPE, particularly if you're a chemical engineer. You can also attend industry events and conferences, and there are some events that we also hold at the University of Shady Grove that are meant to attract people in the area interested in the biotech industry, such as our bio-networking summits. So you consider networking kind of your secret weapon, just reconnecting with folks who are now in the industry, attending local events, and using informational interviews to learn more and get referrals. It's really critical to kind of know someone in the organization, because they can be very helpful in spreading your CV throughout the organization and finding a position even before it's posted. Next is to identify job opportunities. You first have to decide where you're targeting your search. Are you more interested in large, medium, or small firms? You can use job boards to find openings. Most companies will post on Biospace, MassBio, or LinkedIn. So those are some to consider, but there are many other job boards you can consult. And then whether you might want to go out and work on your own or work in a consulting firm, something to think about. If you're currently a resident of the Maryland, D.C. area, there are many instrument companies that have their home in this area, so that might be something you want to consider. And then there are CDMOs such as Sigma, PPD, and Thermo Fisher is an instrument company that's located in Frederick, Maryland. If you determine that you need some upskilling, then you may want to stay updated on what the regulatory changes are, and that may help you with your job search. Possibly when you're interviewing, the hiring manager may be asking questions about recent regulatory changes. So it's always good to stay up to date on that. You can take online courses if you're interested in regulation. You can take them in regulatory science. Or you can take in-person courses, for example, at the University of Shady Grove in UMBC's programs. You can also learn more about emerging technologies such as cell and gene therapy, again, by taking courses or attending conferences or seminars. So these are some other online course opportunities, Coursera, edX. RAPS has some online courses you can take, as well as DIA, and UMBC has online courses you can take. You can also consider certifications such as the regulatory certification through RAC, project management, PMP certification, and clinical certifications. And then learning about GXPs, the IND, NDA, BLA process, and biotech business models. These are all beneficial things to you if you're considering a career in the industry. So I just wanted to talk briefly about 5 new and emerging areas in the life sciences. And these may be sort of hotspots to think about because these are rapidly growing areas, and it's likely that there'll be more opportunities for employment in these areas. CRISPR and genome editing is growing rapidly. Of course, CRISPR-Cas9 has been used for products that are already on the market, but I think in the future we're going to see additional new products using Cas12 or Cas13 because they have certain benefits over Cas9. So definitely keep an eye on CRISPR genome editing because this is likely to continue to grow in the future. Synthetic biology is another area of expected growth. This is all about engineering living systems to design novel biological functions. So this could relate to biosensors, bioplastics, and metabolic engineering, and this is likely to have a very broad impact. As broad as fossil fuels all the way to transforming manufacturing for biopharmaceuticals. mRNA technologies are likely to continue to grow in the future. mRNA vaccines have obviously been successful since the COVID-19 pandemic, and they continue to be a source of study in ongoing clinical trials. And lipid nanoparticle delivery systems continue to be developed and improved. So there's likely to be a lot more effort and work in the future. Many companies are working on personalized vaccines that use mRNA technology, and these are likely to have expanded therapeutic uses, especially in oncology. And then AI and machine learning and drug discovery, of course, last year's Nobel Prize in using AI to develop computer designed proteins using AlphaFold and DeepMind. This is likely to be a rapid area of growth in the future. Many companies are considering this to be a possible reduced R&D cost in identifying and developing novel drugs for the future. And then bioinformatics and multiomics. This is really about unlocking biological insights through big data, integrating genomics, transcriptomics, and proteomics. Identifying new biomarkers for discovery is going to be a tremendous growth area for the future, not just for cancer, but for many different disease areas. And this will be supporting precision medicine and advancing diagnostics for the future. So all companies are going to be very interested in these skill sets. And if you want to learn more about where did I get this information about growing areas of the industry, these were the sources. It's also really important to keep yourself up to date on industry news and technology. These are some suggestions on how you can, and these are all free, so you can keep yourself updated. You can put yourself on a listserv, so you'll get regular emails from BioBuzz, Fierce Biotech, Stat News. I highly recommend that you read International Pharmaceutical Quality, because it keeps you updated on the latest regulatory and quality issues in the industry. And Genetic Engineering News is quite a good periodical for looking at trends in the industry. And then, of course, continuing to read journals that might be relevant to your area of interest is going to be important. So updating your resume and getting ready for the interview. We already talked about tailoring your resume to the role. To prepare for the interview, you need to think through what might be on the mind of the interviewer. Are they interested in regulatory challenges that they need to address in the future that you might be able to help with? Are they interested in decision making? Maybe you've had a role in decision making in your current position or your former position, so that could be something of interest to the hiring manager. Emphasizing your insights that you gain from government and how that can relate to industry knowledge, and then use all the resources that are available to you. I provided the link to UMBC, but it's also really helpful to use generative AI chatbots. And ChatGPT for a $20 a month subscription can really give you a lot of help, a lot of useful information. ChatGPT can take a look at your resume, your CV, and make suggestions for improvements. So it's really worth that $20 per month. What are some salary expectations and how do you negotiate? How does the industry pay comparing to government? In general, the trends are that industry pays better than government pay. But we'll talk about some resources later on that you can look at, databases that can give you an understanding of that. And then understanding what they're offering when they make you an offer from the industry includes a base, bonus, and equity, could be stock options. So you want to look at your resources like Glassdoor and Levels, FYI. They can give you information on current industry trends for pay, and you can use that as a basis for your negotiation. I find Glassdoor is particularly helpful. So, sorry. Again, just to review, one thing to expect is that it will be a little bit of a culture shock transitioning from government into industry. The timelines are faster. The goals are all profit driven. There is a business first mindset. So you may have had a public health mindset in the past. Now you have to really think more business oriented. There's a lot more accountability and there are a lot of performance metrics. You'll be compared to others based on those performance metrics. It may be quite different from what you were used to in government. And then you will have to learn how to influence without authority. So if you had a management position in government before, you may have had a lot of authority over other people, but industry organizational structures tend to be very flat. So there's only very few numbers of managers. So you may have to influence others without actually having authority over them. What are some of the top companies that are hiring HHS alumni? These are some here: Amgen, Genentech, Moderna, Gilead. If you're interested in smaller biotech firms, please do reach out to me. There is a list of all the biotech, small and medium-sized biotech companies in Maryland, and I can share that with you if you're interested. Also, again, consider CROs. IQVIA, EIQent, and Parexel are all local to the area and are always looking for more new employees. So to conclude and talk about the next steps, again, refine your resume, update your LinkedIn profile, expand your professional network, apply for targeted roles. Don't just send your resume out to 50 different things and hope something will happen. And then be prepared for those interviews. Talk with colleagues in the industry about what they might be looking for. Try to get some internal insight from others. And that can get you best prepared for your interview. And most of all, stay confident, be proactive, and some final tips: be patient. It may not happen right away. When an industry position opens, especially big pharmaceutical companies, hundreds of people apply. So you really have to find a way to make your applications stick out. Find a way that the hiring manager will see it quickly and hopefully move to the next step to interview you. You always have to be open to learning because industry is constantly changing. So there may be new systems that you'll have to adapt to quickly. Definitely leverage your skill sets that you gained either in the public health sector or in the regulatory sector. And don't try to do it all by yourself. There are lots of resources available, including UMBC. So please do reach out to us. You can reach out to me as well individually. Happy to share additional resources with you. I'm also happy to take a look at some resumes to give you some feedback and help if you need it. And I can end there or be open to any questions. I guess they have to come through the chat. I'll take a look at the chat now.
Mark, thank you for making that offer to review resumes. That's amazing. I know that means a lot to folks, especially with the years of experience that you have in the field. Career services profession knows what hiring managers are looking for, but you know what folks are looking for in the industry. So,
yes. Yeah, I don't see any questions in the chat. Did anyone have any questions?
Well, what I will say is maybe I know you had your email up, but perhaps we want to throw it in the chat so that folks can copy and paste it and potentially get you those resumes over.
Yeah, absolutely. And used to looking at resumes all the time for my students, and I try to maintain as broad a network within the industry as possible to benefit my students. So I'm happy to leverage that same network to your benefit.
Promise we don't bite. If you do have a question, there's nothing bad will happen. Feel free to throw it out there. If not, I still want to say thank you, Mark, so much for doing today's session. I was a biochemistry major in undergrad and a biotechnology master, and I learned a lot today. So if I ever decide that staff work in higher ed isn't what I want to do, I know what to come to. For those of you who are attending, you take a look in the chat, you will see a URL for our survey. So again, those survey responses really help us know which sessions are impactful and helpful for you all, either during an actual transition from previous employment or in figuring out what to do with current employment. So we want to make sure that this is an impactful series that we're able to continue. So the survey is there. Mark's email will be there shortly. There'll also be a follow-up email that will go out later today or tomorrow with the recording of this session along with the slide deck. So if anything went a little bit too quickly and you feel like you just need a second chance to review it, you'll have an opportunity to do so. And all other sessions that we've hosted are also available online. You'll be able to see that on the UMBC Paws and Pivot website. So you'll get that in the email. Mark, any final?
Rex, I see Patrick had a question. Thoughts on non-science roles in biotech and finance. Yeah, it's a good question. One thing you might want to consider is project management. There's always a need in the industry for project managers who have sort of a broad knowledge of all the different areas within the industry, including finance. So that could be one thing to think about. Another is often people don't think about scientific or technical writing. So even if you have a technical background, if you're a good writer, there's a huge demand for technical writing. So that might be something to consider as well. On the finance side, I can't really offer too much advice because it's really not my area of expertise. Sorry.
That's a great question. Any others? You never know. Someone else is probably thinking what you're thinking. We know that folks are, navigating very difficult times. Folks might not feel comfortable coming off of camera, for reasons of, self-preservation. So you do have our contact information. You do have the survey. You will receive a follow-up email from my team, again, with the slide deck and the recording. And I think Mark has already provided his email address. So thank you all so much for taking the time to spend this lunch hour with us. Hopefully we'll see you next week. Next week's session, I will be covering ATS, how to get your resume past the automated systems. So we all know that in today's world, everyone is leveraging AI, even hiring managers. So next week's session will speak to the effect of how to tailor your resume to get past those systems to make sure that a human being has an opportunity to look at your credentials and consider you for a role.